When I talk about childcare in this presentation, I'm referring to any care and supervision of children by adults who are not the children's parents or guardians. This can include care in childcare centers and preschools, as well as by babysitters, relatives, and other providers. And this report responds to the Council's request for an analysis of the need for and availability of childcare in Montgomery County. We did look at childcare for all children, but our focus is on childcare for young children, specifically children under 5 years of age.
I think the report is good, but I think it's limited. And, because you don't have enough data to tell us how many people probably are staying home, their kids are staying home. And so, like you have pointed out correctly, this data is rough, and the ratios are rough because the ratios don't reflect any nuance in the population. It would be helpful if, to the extent that we can either get to the nuance directly, or at least understand at what income levels is one parent staying home. As much as 25% of anybody's income is 25% of anybody's income. Sometimes when your income's high enough, the 25% doesn't confront you with choices the way it confronts other people with choices, or at least not choices that are life-affecting in a meaningful way. I realize not having $1 million painting can be life-affecting, but it's not the same thing. So I hope you all can figure out how to broaden the depth of this. I'm interested in the New York presentation. I would be interested in the analysis, just the dollars and cents analysis of what it would take to open and operate a daycare center. I mean, with reasonable assumptions about, what does somebody make who owns one? What do you have to pay staff who work there? And this is where quality childcare really comes in, because you have places where the staff is paid absolutely minimum, and while they're old enough to be doing this, they actually have no qualifications to be doing it. And then there are childcare centers that have to compete with people who have degrees, early childhood degrees, to work there, and it's very hard to make that work appealing if you're paying them $12.50 or $15 an hour. That's one of the, I think we'd all agree, one of the sad things about society, one of the most important jobs, which involves raising kids to make sure they grow up and are fit and healthy members of society, you don't get paid enough to make it worth your while. And if you've gotten a college education, I'm sure everybody in the world would be asking you, why on earth would you choose to do this when you've got yourself a bachelor's degree? And that shouldn't be a question you ask somebody who's taking care of children and helping educate and helping the development of children. So I would like to understand what it would actually cost to put something on the ground, because I think that would also get us a better framework of how are the rates charged by child care centers. Are they reasonable or not reasonable? Are they in the ballpark of what you figured you'd have to spend to put qualified people in here, or is there a discrepancy between those two things? And I think that the point of that, in my mind, is figuring out how engaged we need to be in the provision of it, or is it a matter of subsidy? If we can't do it for any less or any more efficiently, then it makes sense to provide subsidies to people who could do it at a comparable rate. And if we could actually provide it for less, then it makes sense for us to look at doing that. But I agree with some of my colleagues that we need to do something a tad more dramatic than what we've done. You've spared me the question I like to ask is, what's the magnitude of the problem and how much are we addressing? It's pretty clear that the magnitude is enormous. Even if you remove the people I think probably don't need it, it's still enormous, and we're not anywhere close to addressing it. I was kind of shocked when you showed me the few people that were receiving subsidies, and I've got a number on the one hand that's in the 100,000s, and I've got a number of people receiving subsidies that's in the low thousands. And it's like, wow, how do I get from here to there? So I'm interested, what New York does, if people have other ideas about other jurisdictions that are tackling this in a meaningful and expansive way. I think we need to look at it. And then we're going to have to make some hard choices about where this fits in to budget priorities. How important is this, and what are we willing to do to make it happen?